Today I want to talk about a new approach in detoxification. It's ion detoxification. A little disclaimer, the system that I'm going to be speaking about, I can only speak to the one that I used clinically and I used to help heal my son, Donovan, and that's the Ion Cleanse by AMD. After we're done here, if you want to stop by the booth and sign up for a session to try it or get more information from a sales and business perspective, please do that. My mission today is to educate you on the process of ion detoxification, how it's different than other forms of detoxification, and how it may help your child add it into their protocols or use it alone and get some really great results. Okay, detoxification impairments in children with autism. Any of you guys working with doctors or practitioners, raise your hand if you've been told that your child has trouble detoxifying. A lot of you. Yeah. This is actually really very common in autism because we have a lot of factors that are in play, but a lot of it starts with the genetic level of these epigenetic mutations that we see that do not allow children with autism to detoxify as effectively as someone that would say not have autism or was neurotypical or wasn't affected by a chronic health condition. So these are some questions that I started to ask myself. Why do children with autism have challenges eliminating toxins effectively? There's more to it than just the genetic component, and I wanted to dive into that. I also asked, how do we overcome these challenges? If some of the tools that we are using to help our children are not working, then what can we do differently to help them? And lastly, can detoxification be facilitated safely and non-invasively in a sensitive patient population? Because our kids are so sensitive to a lot of things that we do, I'm always looking to help heal without doing any harm. Clinical signs of neurotoxic poisoning are pretty prevalent in our children with autism. And if you look at these signs, encephalopathy, disorder of movement, special senses, visual systems, peripheral neuropathies, skeletal and muscle, and psychiatric behaviors, that overlays a lot of the criteria that our children have to meet in order to get a label of autism. This is something that I call the vicious cycle. Our children come into the world with a lot of these genetic impairments. Some of the SNPs, you guys have heard of MTHFR. A lot of people have been talking about that for about 5 years in the community. That's only one, but it is pretty important. So they come into the world with these epigenetic changes that leave them already vulnerable to not being able to detoxify their body. Or sometimes our children are born with underlying infections. Maybe they have Lyme, maybe they have high viral, and that they come into the world that way. And that also leaves them vulnerable to a detoxification impairment. So you put those two things together, and then you introduce more toxins into their body from a toxic environment, medical interventions, bad food, bad air, bad water, all of these things together. And it just creates this vicious cycle of further impaired detoxification. Then they begin to have nutritional deficiencies. And then what little bit of immune system functioning that they have begins to tank. And they really start to have a spiral of pretty severe symptoms for a lot of our kids. So I want to talk about something called voltage-gated ion channels. We don't have to get super technical with this, but I do think it's important for you guys to understand the role of these in the body. Every cell membrane has these little gateways, and they're doors that allow nutrition into the cell and toxins back out. They are regulated by electrical voltage, and those are those gates that open up. They will perform this process billions of times throughout the day. However, we have an issue with something. Actually, let me just point out that these channels actually regulate really, really important things for our kids like GABA, serotonin, dopamine, norepinephrine, and acetylcholine. So if you guys have been hearing that you have dopamine or serotonin issues in your children, this is going to be important as we dive into this a little further. When these voltage gates stop firing open appropriately, it's something called a channelopathy. It's a blockage that stops the communication, the electrical signaling at the cell membrane. Some of the things that create these channelopathies are an assault on the body. It can be a pathogenic assault, high viral, bacterial. It could be a toxic assault, heavy metals, pesticides, glyphosate, chemical poisoning. It can also be a traumatic assault, a child that had a traumatic birth, a child that was maybe mistreated in an ABA center. anything like that has the ability to create a channelopathy and block the cell's ability to open up and transport nutrition in and toxins out effectively. Some of the risk factors for these that create that is also the epigenetic mutations that they're born with. And there's something called cell danger response. How many of you guys were sitting in Dr. Navio's talk where he was speaking about cell danger and mitochondria? Okay, a few of you. That was a really, really excellent talk, and everything he said is spot on. Our bodies go into cell danger response anytime that we are exposed to stress. Our children are oftentimes in a primary state of sympathetic dominance. Have you guys ever had someone tell you that your child is stuck in fight or flight? Yeah, a lot of you. Exactly. That's because they are in a state of stress response in their body, and that's going to facilitate cell danger response. And we'll talk about that a little bit more too. We have these mutations. MTHFR is one of them, but CBS, CYP, COMT, those all pair together and create further issues in our detox pathways. We also have a hydration issue. A lot of our kids are walking around chronically dehydrated. They have sensory issues, or they don't like to drink water. They don't want to continue doing that all day throughout the day. And they're not getting the amount of fluids that they need to help motility in the gut. So they're not having as many bowel movements as they need. They're not getting enough fluids to support cellular health and open up those membranes. They're not getting enough fluid to help their brain balance very well. So some children can actually have seizures due to dehydration. And it may be such a simple thing as that, but unless you know what the cause is, it's easily overlooked. One way that I like to describe what's going on with our children and the toxic assault to their body is the analogy of a house that has burnt to the ground. Our children, once they have a diagnosis of autism, they are a house that has burnt to the ground. Something has gone in and has caused a catastrophic fire and has kept them inflamed, and now all of their systems are not functioning appropriately. What I've noticed in treatment, and I've been guilty of this myself in practice, is that we tend to be so quick to go in and try to rebuild that house. We want our kids better, especially if you have a child that regressed in front of your eyes and lost what they had. We get really, really caught up in going in and throwing so many supplements and products and tools at them so quickly, but we forget to do two really critical things. We need to identify the source of the fire, and we need to clear away the rubble of that fire. We cannot rebuild a house on the rubble. It will not be sustainable. And in some cases, kids that have too many interventions in their body before their detox organs are ready to receive those actually have further regression. That gets into why ion detoxification, why choose it, why consider it, and why does it work for these kids. A body that's already in an impaired state of transport, it can't easily move the nutrition and the toxins in and out. Those are those channelopathies that kind of grind everything to a halt. So when you start putting good supplements in and good food in and lots of water, and you're doing all the things right, all the things that the doctors are telling you to do, but you're not seeing gains or you're not seeing progress with your child, it's probably because somewhere along the way, all the good tools you're putting into their body cannot be moved from point A, where you're giving it to them, to point B, where their body needs it. There's a block in the transport that's not allowing this to happen. And then there's a further issue with this, is that the more you give to them that they're not able to move through the body, it's going to stack and stack and stack until you start seeing regressions, behaviors, a lot of aggression coming in with these kiddos, and worsening of symptoms. And that is a really good clue that you have a body that's not ready to receive all of the tools that you're trying to give it. The process of ion detoxification begins with the parasympathetic nervous system. It's all about the parasympathetic. You can try to detoxify a body all day long. If a body is not able to go into a state of relaxation and come out of that fight or flight response, it's not going to be able to detoxify. When we go into parasympathetic activation, we are doing a couple of things. We are facilitating what's called rest and digest. This is where the body begins to give the body permission to electrically discharge those excretions. It's going to leave the body with either a positive or a negative charge, and it's going to try to move those excretions through the body. but if those electric gates are not firing and the signaling is closed, those charges can't move through. And so you're going to need to find another way to do that. Ionization through ion detoxification, specifically through the ion cleanse system. We're doing a two-step process here. We are creating a low-level electrical current, and that current has been filtered through a very specific pattern. The pattern is there to communicate to your child's body a relaxation response. We can actively take them from sympathetic dominance in that fight or flight state and swing them over into parasympathetic and get them into the exact place where they need to be to effectively detoxify. So the system is brilliant for being able to override that and give that body that permission to begin detoxifying. It also does the second process. It creates ions of positive and negative charge in that water field in an opposite pattern. It does this through a very simple process of electrolysis of water. So how many of you have been over to the booth and had a chance to do a session? A few of you. Did you guys notice at the array plate that like smoke effect that was happening? It's so cool. It's molecular hydrogen. We are literally splitting the oxygen and hydrogen away from each other in the water to create those charges to help mobilize these excretions through our kiddo's body. But there's a couple of things about this process that we need to address. And so this is my elephant in the room slide. If you guys will be super brave, if there's any of you in the room that think that ion detox is a scam, will you raise your hand? I promise not to judge you. Yes. Okay. I love it. Listen, I did too. I did. I only bought our ion cleanse 4 years ago because my MAPS doctor recommended it for my son. And I was pretty sure that I had just wasted money on something that was not legitimate, it wasn't real, and that the color of the water was going to change with or without fee, and you really weren't detoxing. And I think the reason that happened and why we have these misconceptions is because there is a lot of bad info out there. If somebody tells you that the water is going to change color, but it's all your detox coming out of your body, that's false information. That's not accurate. Because you're doing the electrolysis of water and you're putting an electrical current into that water field, you are creating oxidation. So that orange color that you see with or without feet that's in the photo, the one that's to the right is the one with no feet. That's the color change from the process of the oxygen molecule working on the radicals that are in the water. It's going to happen. However, noticing the difference of water between those 2 feet or the 2 sessions is where it gets interesting. The water, it is both your detox from your body through the eccrine pathway of the feet. There is a lymphatic drainage system there, and you can utilize it during rest and digest when you're in parasympathetic activation. So that's why you see such drastic difference between the one on the left and the one on the right. But acting as though that color change will not occur without feet in the water is just, it's not accurate, and it's unfair to parents that really want to understand the process. Different people from session to session to session are going to have different results. I had 4 machines running in clinic when I was in practice, and I can tell you that person 1 to person 2 to person 3 to person 4, every single one of them always ended up looking entirely different than the other. It really is dependent on what that person's toxic burden is, what their impairments are, how fast they're able to excrete, or whether or not their body's even going to detox into the water. Not everyone has a really dramatic detox effect into the water, and I'm going to talk about why that is. Some of the results that we're seeing by using ion detoxification for our kiddos and even for adults, I mean, really, if you guys get the system, every one of you should really be using it. There's just too many toxins for us to keep up on in the world today, but I want to show you some of the data that we've been looking at in the research section. Toxic metals. This one is my favorite because it really helped me understand just how big the benefit of using the system really is. Sometimes you look at that water change and you think, oh, wow, that was really gunky, or oh, there's a lot of foam, or it's really brown today. I had a great detox. But when you think about it, you're actually, that amount of detox that's in that water, I like to compare it to that being a tablespoon versus a gallon of what's happening up to 72 hours after each session. And we were able to track that using the Genova Toxic Elements Profile. So we asked these participants to give us 24 hours of urine I can't even believe they did it, to be honest. Imagine every single urine sample you have for 5 days has to go into a bucket and you have to send it off to the lab. They were really gracious to do this for us. What we were looking for, we did it for 5 days prior to introducing the ion cleanse to them. We did 1 half-an-hour session, and then we did 5 days, 24-hour urine collection again. So these people gave us urine for 10 days straight. They were super troopers. And this is the results that we found. Overall, 34% increase in the urinary output of toxic metals. That means 1 half-an-hour session in these people, age 4 to 69. Okay, there's no age range here that we can't help with. 34% increase in toxic metals in their urine on day 3. Now, I really want to focus on the Analyte List. Are you guys seeing that? That's the actual analytes from that testing. Antimony, arsenic, barium, bismuth, cadmium, cesium, creatinine, gadolinium. How many of your children have had an MRI or need to have an MRI at some point? A lot of you. Gadolinium is the toxic metal that's used in the radiological dye that they use for MRIs. And some of you have probably been hearing in the media that there's a lawsuit now because it's extremely toxic to the brain and very, very hard to get out. But good news, the ion cleanse can help you get it out because we have clinical data showing that. Gallium, lead, mercury. Mercury, one of the hardest metals to mobilize through the body. We are seeing it in the urine post-ion cleanse session. Nickel, niobium, platinum, and the list goes on. Even uranium, these radiological metals that our kids are getting exposed to from the air and the water around them, we can help with that. I want to talk about glyphosate. Not everyone may know what this is, but glyphosate is an herbicide. It's the main component in Roundup that they spray on all of our crops that are genetically modified or are not organic. And even we're finding out that some of the organic farms are really, really heavy with glyphosate. So as hard as you try, there may be circumstances where it is unavoidable. It is extremely damaging to the gut biome. It's extremely damaging to the membranes of the brain and the gut and to cell health. So any chance that you can to be able to help the body address this and get it out is going to be very effective. Terry Herning from Real Food Mom has a clinical practice in Arizona, and she's amazing. She did a study with glyphosate doing the urinary testing from Great Plains Laboratory. Over 30 days, she did a control group of 9 participants, and then she did 10 participants in the therapy window. They did 3 30-minute ion cleanse sessions per week for 4 weeks for a total of 12 sessions. Okay, 12 sessions, 48% reduction in glyphosate levels. That is huge. So far, I have yet to see any other tool that has shown me that level of decrease in glyphosate, especially that quickly. I want to go through a couple of evaluations that were done, 2 by a nonprofit and 1 by a physician in our community. How many of you guys know what an ATech is? Okay, so about half the room, that's fair. So the ATech was developed by Dr. Bernie Rimland, and he was one of the very first DAN doctors. He was a founding member of DAN, which is now known more as MAPS. And it's the Autism Treatment Evaluation Checklist. It's a scoring system that is free. It's available online. If you just Google ATech Checklist or ATech score, it'll pop up and you can fill out the information. It touches on 4 different categories of behavior, social, speech, and medical. It's an excellent way to assess how severe your child is at this moment, what they're facing, and it gives you a scoring system that you can then do an intervention like the ion cleanse and go back and retest and track the movement of the score going down. The lower the score, the better for the child, and anything under 10 is considered possibly not having the autism diagnosis anymore. It's not clinical, so you would need to get that retested, but it's a great tool. So we had a group, Thinking Moms Revolution, approach the company about wanting to do a study, and this is what they ended up doing. They had, oops, let me go back. Okay. In this first study, there was 23 participants, and it was a 4-month window, and they had to do a baseline ATech, and then every 30 days they had to track the ATech, and they were doing every other day cleansing at that time for 30 minutes. At the end of the 4-month window, they saw a 35% reduction in their ATech score. That is a really significant amount of shifting for 4-month window of one thing that was being used. They didn't change anything else in the 4-month window, just added in the ion cleanse. What was really impressive is that some of the children were asking to cleanse more often than the original protocol. So they went back and reevaluated a second study, and they changed the protocol to 3 days in a row, taking 1 day off, and did that for another 4 months. And this was the new data. At the end of the 4-month window, 55% reduction in their ATech score. For some children, this put them into recovery. For some children, it gave them toilet training. For other children, it was speech. It was really, really powerful for these families that were in this study. This snapshot of data forever changed my heart and my mind. Ages 4 to 9 had a 45% reduction. 10 to 12 had a 57% reduction. But 13 to 19, the teenagers that were non-responders, the ones that other people and doctors had said were past the window of recovery. If you've ever heard that, the 8 and over, if they're not better, they're not going to get better. 64% reduction in their ATech score. The older the child, the better the results were. Can you imagine what that was like for that family that had kids that they thought maybe they weren't going to get to that finish line and get 64% reduction in their ATech score? That's life-changing for them, absolutely. And what it did was it proved that there is no window. That group shattered that window when they did that study. I want to talk about Dr. Jerry Cartsinell. I had the pleasure of going to California and having a meeting with him. He had contacted the company and asked if he could have someone come out and educate him on the ion cleanse system, because he had been hearing about it for 4 years from his patients and it wasn't going away. Those were his words. I'm still hearing about it. It hasn't gone away. So he asked us to explain the science of it to him, and we did that. And then he came to the table and offered to do a study. He did a 60-day evaluation. He did use the ATech score as well. He had 13 participants using the system, and they were ages 3 to 22. They did the 3 days on, 1 day off protocol, and no other changes were added during the study window. After the first 30 days, his patients saw on average a 21% reduction in their ATech score. At the end of the 60 days, they had a 32% reduction in their ATech score. These are his patients that he is clinically overseeing. And 60 days. That's the 60-day money-back guarantee window that you have to evaluate it. And what you have to lose is possibly 32% of your ATech. This is what we saw. 20% improvement in speech and language on day 30. Day 60 was 31%. Social ability, 39%. 40% on day 60. Sensory and cognitive awareness, 23% day 30, 29 day 60. Health, physical behavior, 15%. Not as high day 30, but look at that, 34% on day 60 in health and physical and behavior. That is really, really huge. This is the individual data. You guys have all of these slides in your book. I won't necessarily walk through this with you, but what I do want to point out is that this is why I love this company. If you look down at the data, you see at the very bottom, we had a 5-year-old kiddo, a little guy, and he had an 8% increase in his ATech. So of all the people that saw reductions, he was the one that didn't get the reduction in day 60. I don't think that that necessarily means he won't, because the Thinking Moms Revolution studies showed us that some of the kids didn't have reductions till month 3 and month 4. But I also want you to know that the ion cleanse is not a magic bullet. I'm not up here to tell you that it is, or that it works for every child, or that it's going to fix every single thing. It may not. But I am up here to tell you that the data is increasingly showing us how powerful it is for the majority of children who use it. And I think that's probably why we have 95% of families who keep it after they purchase, and only 5% choose to return the system. And that leaves me to my final slide before we do questions. I aligned myself with this company for a couple of reasons. The first reason is because My son got drastically better when we introduced the ion cleanse to him. Today, my son has lost his autism diagnosis clinically. He is, thank you so much. He's a pandas kid, so we still have struggles, but we don't deal with autism anymore, and he's mainstream in education, and he has a world and a life that's open to him that I, at one point, did not think was possible. So I'm sharing this technology because we have a 60-day money-back guarantee. If you try the system and you don't like it, it's okay, because you're protected as a parent that you can send it back. I have friends who have sent it back, and I have friends who've also had serious gains from the technology. So I just want to share that and leave that with you today, that, this is such an excellent tool to try because there's just no risk involved as far as losing your money, which I've done with other protocols in the past, believe me. Okay, let's get to questions.
All right. So question number 1 is, should we do any type of lab work before using the machine? If so, what do you recommend?
I love that question, lab work. So I don't think it's necessary. I think the ion cleanse is one of those tools that you can just pop out of the box, plug into the wall, and do your first session and get going. It's so safe and non-invasive, and we really haven't seen anything that indicates to me that there's a particular set of children who shouldn't use it. Over 4 years, I've never seen it. The company itself has been in business for 15 years with a perfect safety record and an A+ rating with the Better Business Bureau. However, if you wanted to track labs just to know what your child is exposed to toxically, and then follow up after a certain window of time and see if the system is changing that for your child, if you have the budget to do that and the interest to do that, I love data. And the data is really helpful for us, and we may even use it in our research. So if you want to do that, yes, but you don't have to do that.
I did the ion cleanse trial yesterday at sign up, and I noticed a disclaimer about seizures. My son has epilepsy. What are the risks of doing this therapy for my son?
Okay, I love this question. Company policy has and always will be that seizures are contraindicated for the technology. The reason is because it has never been studied. There's also other contraindications on there because they've never been studied. I'm going to step outside of my box here, and I'm going to talk to you as a mom and as a practitioner, okay? I have several dozen people that I worked with one-on-one in practice who chose to purchase the system and utilize it for their children. They were being overseen by a physician to deal with their seizures. And across the board, we are seeing improvements in the amount and the frequency of seizures by addressing safe, non-invasive detox in their body. I hope to do a study at some point in the future using EEG technology with Brad Levy from EEGs to Go. But yes, my personal opinion is that it's safe. The company is going to tell you otherwise.
Is there a cleansing or excretion of good metals like iron or other elements that may be problematic, say for anemic kids?
Oh, fantastic question. Positive metals and minerals. Let's talk about this. The ion cleanse does not have a mechanism to reach into the body and pull out good minerals or good metals. It can't do that. Its only its only mechanism to do that is if the body has already determined that there's too much of that substance in the body and it needs to be eliminated. The body has a perfect system for detoxification. It knows exactly what it needs to get rid of at what time and in what process. So the body is going to handle that, and the ion cleanse is not a chelator. Sometimes we get those two things confused, but it's absolutely safe. Clinically, I've never seen any children have mineral deficiencies after or have issues in their iron. In fact, we use it for the opposite. It can help with kids that have anemia.
Why does it work better for teenagers?
I don't know. Honestly, I don't know, guys. I was stunned by that. I would think that the answer would be that they would have a harder time. Obviously, they're a lot more toxic, but as you detoxify an older child that's had toxic burden for a lot longer, they tend to struggle and have more issues. We didn't see that. We saw a lot of gains and a lot of improvements, and a lot of kiddos get really, really peaceful in 4 months. And I don't know why. I hope to have that answer one day.
So this is a two-parter. One is, what is the best schedule or duration? And then should you be giving any support or mineral support when they do the ion cleanse?
I think that the best schedule is, if you're going to use it for autism, there is a protocol that comes with the machine when you get it. It's a gift that was given to you by Thinking Moms Revolution and AMD. And it is 2 or 3 days on, 1 day off. And then there's a chart that tells you age ranges for how many minutes you do the session. And it's been very, very effective for the majority of families. There will always be certain children who are more sensitive and may need to go lower and slower, but that's pretty quickly identified once you start detoxing. As far as supports, you don't need to be on anything. I do recommend that people take mineral supplements when they are detoxing. Doesn't matter if you're doing ion cleanse or biomat or a sauna or BioRay herbals. I don't care what you're using. The body burns ATP at much higher rates when you're detoxing, and minerals are absolutely critical to replenishing ATP at the mitochondria. So I do recommend that.
If children in the autism spectrum have difficulty detoxifying and are severe, do the metals and toxins get to detox even though they're very ingrained in their system?
Great question. Yeah, they do. And that's because the body really does have that perfect innate system for detoxification. The challenge, let me ask you a quick question. How many of you guys have ever done or know of someone who has gone in and done chelation and had absolutely disastrous results? A few of you. Yeah, me too. I know a handful. I don't think it's that chelation is bad or that it was wrong. I think it was because the body wasn't ready or able to open up those pathways and do that rest and digest process to allow those metals to leave through the stool and urine as they're supposed to. So you go in, you force them off the receptor site, but if they can't leave the body because the excretion pathways are not communicating and flowing, you're going to have a problem. This system has been the answer to those patients. That's why I used it clinically. This is why I recommend it. It overrides that, opens up the pathways, gives it that elimination route so that we're not seeing the challenges coming with redistribution of metals.
Which toxins would the system not help?
There is no toxin that it doesn't have the ability to assist with. And the reason is because the ion cleanse doesn't play favorites. This is simple physics. Positively charged elements such as toxic metals, histamines, and pesticides. On the flip side, negatively charged elements, mycotoxins, endotoxins, herbicides like glyphosate, and most of our organic acids. All of those carry either positive or negative charge. That's what the ions do, is they influence the toxins of the opposite charge. So there's really nothing that it can't have the ability to help detoxify.
Is there a better day or time to use the ion cleanse?
Every child is different, but for the majority of them, usually cleansing after dinner or shortly before bedtime has been shown to increase sleep and help with the relaxation process, especially for kiddos that are not yet sleeping through the night. Other children, although it's more rare, are the kind that get more excited through the detox, and so families will do that right after school and give them time to kind of calm themselves back down before bedtime.
So if drinking water has some toxins, is it better to stick with alkaline water to cook with or drink?
You know, I think that there is no safe water. I mean, really, let's just be real about that, okay? Unless you have a $6,000 or $8,000 water system in your home and your pipes have all been tested and they're super, super clean, you're going to get exposed to toxins. Don't worry about it. Don't stress as much about it. It's important, obviously track it, but there's so many other things that need to be looked at. So just use as clean of water as you can, and then just make sure that whatever detox tools you use, that you're keeping that as part of your daily plan for your child and for yourselves, because our bodies are no longer able to keep up on the amount of toxic burden that we're being exposed to. It's not possible. So just keep doing detox overall, and it should be okay in the end.
I wonder why aluminum was not showing up on the slide where you showed the study of excretions in the water.
The study of excretions in the water?
That, I guess you had a slide that says.
Oh, let's go through it.
Yeah, there you go.
That's a really good question. I think it was too. I think that's a typo, and I apologize because we know that aluminum is influenced by the ion cleanse. We've seen it in all of the labs, and I personally have the Analyte List from Genova. So I apologize, that is a typo. Aluminum is influenced by the ion cleanse system. And I believe that the literature that's at the booth is actually correct. So please go over, check that for yourselves. It is influenced by the ion cleanse, definitely.
What makes this product different from other products on the market?
Other foot bath products on the market?
I'm going to assume it's other foot baths.
Or just in general? Okay,
I'm
I'm gonna do that twofold since we've got a few more minutes. There's other foot baths out there, you guys. There are, and they're cheaper than our model. There's also other foot baths out there that are more expensive than our model. But I have seen a lot of foot bath systems coming through to market lately, and I'm scared. I'm really scared by this, and I've been speaking out a lot about it. It has nothing to do with the fact that I am aligned with Ion Cleanse. If you find something that works, does what it says it's going to do, and has a perfect safety record and a money-back guarantee, and it's cheaper than the Ion Cleanse, I'm going to tell you to buy it because I'm an autism mom. So I care about your budget, but I also, more than that, care about the health of your child. These systems are battery chargers. They are pyramid battery chargers that you can buy for $50 at Walmart. They get sent from China to a factory in America where people slap stickers over them and plug an array in, and they tell you it's a foot bath. It's not a foot bath. It doesn't put you into parasympathetic. In fact, they've been shown to put you into a stress state and lock down your pathways, but it'll change the color all day long because we talked about that. Color change of the water is not indication of detox. And also, those systems, they don't have an external medical grade power supply. So if you drop that machine in the water, that could be really, really dangerous. It could be deadly. Some of the systems are now coming out with little printed labels that say, please keep far away from water. Are you kidding me? I'm sorry. This is a human life. This is my child. My child is priceless. I'm not going to save a few $100s on a risk for something that says keep far away from water. Any foot bath system that you choose needs to have an external medical grade power supply, and the array plates need to be made with medical grade stainless steel. Okay? And that's the only way that your child is going to be safe if that machine falls in the water. So that's my thoughts on that. Now, if you're asking overall detox is what's different from overall other tools, I think it's very, very different because it activates the parasympathetic, but it also has both positive and negative ions. The biomat can activate parasympathetic and it has negative ions, but it doesn't have positive ions. So it's missing critical half part of detox. Mycotoxins, endotoxins, glyphosate, organic acids, and candida. Those things need positive ions while in parasympathetic in order to be able to excrete effectively. I have yet to see any other tool that does that process like the Ion Cleanse does it. But that doesn't mean they're not effective. It just means I like this system better for that reason.
Last question is, we have the machine, and after 6 months of consistent use, we saw no changes, good or bad. Are some kids just non-responders?
Yes. The answer is yes. I love that you gave it 6 months. I think that that was excellent. I think that that means a couple of things. It means that your child is a non-responder to this particular technology. It means that you're missing a piece of the puzzle. Maybe it's an underlying infection that needs to be addressed. And it doesn't mean that the Ion Cleanse isn't working. It means that whatever it's doing is not the reason that your child isn't reaching the gains of what you're looking for. I would probably tell you to continue looking at the infectious route and keep your Ion Cleanse. But you also have the option to sell it at a discount to another family that maybe can't afford the full price. And there's lots of people who do that, and that's a really good way to give back in the community if it's not working for you.
You're all done.
All right, thanks guys.